Happy to be here to talk about a holistic approach to patient assistance. I am Tiara Green, the president of Excessia Health, and we're just going to take a few minutes to introduce ourselves.
I'm Gina Glass with Dreamsicle Kids Foundation here in Nevada.
I'm Jennifer Noonan with Excessia Health.
I'm Jonathan James with Hope Charities.
And before we get started, we heard a lot this morning about helping individuals afford their copays for medications. We want to talk about going beyond that. And part of Excessia Health's holistic model is looking at not only just their medication copays, but their case management. It's great to have medications, but you need insurance as well. So we provide case management and we walk through the insurance options that are available. That's half the battle, right? We're just getting there. What does it mean to look at your out-of-pocket maximum? What does it mean to pay a co-payment or co-insurance? We walk them through that process. Then we look at, okay, now you have the insurance. How are you going to pay your health insurance premiums? And we help to afford those health insurance premiums. Of course, looking at their medications, but in order to receive a medication, you have to see your physician. And that means that we help with paying the copays to see physicians. We help with laboratory costs and durable medical equipment, and then paying for the travel to get to their physician or to pick up any medicines. On top of all of that, it's important to understand the healthcare landscape in general. So we provide education. We have a webinar series, Amplify Your Voice, Control Your Care, in which we provide information to equip individuals to make informed healthcare decisions. So when we're talking about a holistic approach, we're talking going beyond the copay assistance for medications, and we're talking about reaching individuals and helping them with all of these items as well. The last one that I did not mention is legal services, because a lot of those that we work with may be eligible for Social Security disability income. And we assist by having attorneys on staff who represent individuals for free, free 99, free. We represent them as they appeal Social Security decisions. We will fly to wherever they are. We are nationwide, but we understand what it means to be able to afford care. So that sets the tone for what we're going to talk about today. When we're saying holistic care, those are the items that we're referring to. I want to spend some time, and we'll start at the end with Jonathan. If you could just tell us a little bit about your organization, what it does, and how you got involved in the space.
Yeah, thank you so much, Tiara. It's great to be here with all of you. I feel like this is a room full of friends that you don't always know every face, but every face has a familiar story that you're very accustomed to hearing because you've lived it. So a little bit about me. I was born at an early age. That was a bad joke, sorry. I left my kids at home. I felt like I needed to bring some dad joke material, but I just decided to hold off. But anyway, sorry about that. Moving on. No, I was born with hemophilia, severe A, and was really affected severely by a lot of joint disease and joint damage throughout my life. Had 10 major joint surgeries. I was actually a financial advisor helping people in my adult career with trying to navigate financial planning issues, and along the way I found myself in a very difficult financial situation personally and lost my home, lost my business at the time, and as a result of just trying to cover out-of-pocket medical expenses, and so became very, very educated by an unfortunate set of circumstances to try to figure out how to navigate life for myself. Was confined to a wheelchair for about 3 years and really just suffered a lot personally, but realized in the journey of that there was just so many gaps that we didn't realize how bad things were. I did all the things that you're supposed to do. I had 6 months of savings and investment portfolios and all that stuff. I listened to my own advice that I gave my clients. And even with that, after 2 years without a paycheck, it still becomes a burden that you just can't bear alone. And so in 2009, we started Hope Charities, my wife and I, really as a passion project to just help give back and to help people navigate resources. Never in a million years thought I'd be doing this full time, But in 2013, it was an opportunity to really just try to build up the resources that we do. So today, as an organization, we still help people nationwide with hemophilia, von Willebrand's disease, and many other rare bleeding disorders, with navigating resources, helping with premium assistance, copay assistance, as well as vital needs programs for housing, utilities, transportation, communication. So doing a lot of work in that space, especially, and now even more so, even in advocacy in terms of policy work. A lot of you have heard of the issues going on with AFPs, working on a lot of programs related to that. PBM reform is near and dear to our heart. We're working on a bill for those things. So that's kind of what we do, a little bit of everything. So yeah, that's my story in a box, and I'm sticking to it.
That's a lot. That's good, right? Lived experience sometimes is the best experience, and a lot of our dreams are born from some of those lived experiences. Jen.
I'll try not to be so loud on my microphone. As I mentioned before, I work with Excesia Health, and Tiara has provided us with some background on that, but my background was in nursing. My baby nurse job, I will say, started me out in the emergency department. I worked in an urban area in the Louisville, Kentucky area for about 17 years. And it was a fairly impoverished area. We didn't have a lot of resources for our patients. Just the clinics there were oversubscribed. So we treated the entire community for any and all ailments that they might have. It often was outside of emergencies as well, but we did have a population of folks in the area that had bleeding disorders, hemophilia, and specifically sickle cell. And I saw firsthand early on how communities that don't have access to everything that others do leaves those folks in a lurch. Lack of treatment, stability, if anything else, just unable to get into a clinic or a treatment center. They would, spend most of their free time in the emergency room, getting patched up, if you will. After working in the acute care setting for about 17 years, I moved into hospice and palliative care because emergency medicine just wasn't enough of a difficult area to work in. I began working with the pediatric population in hospice, and that was when I first understood that rare disease has an impact even further reaching inside of people's homes that I never knew, going into folks' homes. I think when I really realized I wanted to work in a setting where I could do more was when I was introduced to families that had Duchenne muscular dystrophy. And at one point we had a family that had 3 boys homebound on vents all at the same time. And so, just seeing the families that struggled just to get up and brush their teeth, put one foot in front of the other. It was hard to watch. We provided what resources we could, but from an earlier discussion, I want to also say that as a nurse, 25 years I worked in direct patient care, and I had no idea that financial assistance was available, care navigation. So that's kind of my first soapbox. But now, knowing the industry, I think for me it's been more about, it's not enough to just find and seek donations. We also have to find the people that need those the most and make sure that we're not just handing out money, but we're finding the people that aren't getting access to those things. So, all right, you're up.
Georgiana.
Well, I'm just happy I did not have to get on a plane and go across the country. I literally just went 15 minutes down the street. So I have been in Nevada about 8 years. I come from California. I'm the mother of 2, so I was a teen mom and overcame that and thought I was lucky. My kid was perfect. I didn't need any more. And somehow 13 years later, I ended up pregnant with another child. And she was born with sickle cell disease, which I vaguely knew about, but didn't really know the ins and outs. But I'm a researcher, so I began to study and see what it was. And one of the biggest things that stood out is that the burden of costs for it. So we lived in Orange County by Disneyland, so when I saw it was like over $1 million over a lifetime to care for a patient with sickle cell, I'm like, oh my God, even though I make decent money, I don't think that we're gonna be able to sustain in California. So we began to try to find other cheaper places to live, and we landed on Nevada. Got there, landed another good job with an insurance company. My background is in insurance, so I planned to work that dull, boring job until retirement. However, my daughter began to get sick, so she was about 1.5 years, and she started getting sick, so that meant time away from work. And with sickle cell disease primarily impacting African Americans, my job really didn't have any understanding and weren't familiar with the condition, so it kind of would appear to them like, well, her kid looks fine, so why is she not at work? Before we left California, my cousin and I, who's sitting over there, we were talking about, oh, wouldn't it be cool if if there was something called Dreamsicle, because it has like the creamsicle pop and it's cute. And we were like, well, California already has a lot of resources for people with sickle cell, so we don't have to worry about that. But after missing so much work, I was eventually terminated, even though I did everything right, got FMLA and everything on a technicality, they let me go. And I decided to not rush back into work, even though that's all I knew. I decided, and my family said, well, you should, try to create an organization to help people like you so nobody else has to go through this. And from there, my focus became creating an organization that had information about how to navigate the healthcare system, working with disabilities. And Dreamsicle Kids Foundation was born of that, and we're the first sickle cell disease organization in Nevada, and we provide direct support to patients and families impacted by sickle cell, from transportation, utilities, prescription co-payments, anything that you can think of outside of the clinical scope. We provide that support to them, because that support I wish I would have had that I didn't have. And one of the unique things about that is that we aren't income driven, because I was a person who made 6 figures and suddenly I had no job. And after savings starts running out, you have to figure out other ways to keep the lights on and pay for prescriptions. So regardless of your income, if you are impacted with a rare disease and need some additional financial support in an emergency, we try to be there for you.
It's amazing.
Thanks.
It's
So
amazing.
good.
I think most of us in this room understand the healthcare burdens, right? We wouldn't be here if we didn't understand the burdens of navigating the healthcare system. I want to share just a few statistics, and we heard some of these earlier. Almost 40% of Americans report putting off medical treatment due to cost in the last 12 months, right? 63% of adults say that they or someone in their household had to forego or did not pay for food or clothing because they could not afford it due to medical debt. And then 1 in 5 are unable to get the care they need because they do not have the transportation necessary. Right? These are things that impact this holistic care model. If we look at this even a little further, there was a poll that came out, and it found that 12% of adults are health literate. Only 12%. So we think about these conditions that you all mentioned and that you've been around. What would you say the impact of health literacy is in managing healthcare? Good, Georgia Day. It's understanding basic health insurance terms or health terms in general, right? So when you think about health literacy, and I can't see you, so I don't know where that came from. It's this bright light here. But it's understanding basic health insurance or health terms in general. What does it mean to have a copay? Understanding what your physician is saying when they're talking to you. Understanding where to go when you need to look for resources. Those are the things that are included in health literacy.
I guess I'll start just by mentioning I do think that 12% is absurdly low. working in the financial space for a long time, one of the things that I began to realize was that there's sort of ranking like mild, moderate, severe. Like you might say that, oh, you have some form of literacy, but it's still very minute, right? And so when you come up against certain barriers, you may know, oh, well, I need to go to the emergency room, but you don't always know what is the balance between deductible and copay. And we've seen a lot in the last 5 years even about the accumulator adjuster problems as well as maximizers with insurance. The level of expertise that's really demanded upon us as the American public is really quite extreme. And so, to be honest, I listen to a statistic like 12%, and I think in this context of the work that we all do, and I actually think that's kind of high compared to the amount of people that we hear from day in and day out. I would say probably less than 5% is a really realistic number as far as people that really understand what those terminology, what those terms mean and definitions mean. So, I would just say that the complexity of the system is sort of demanded by the powers that be in order to be able to try to mitigate costs because there's just not enough money to go around. The unfortunate reality of that is in the U.S., it's incumbent upon us to basically educate ourselves, but also to empower others to be educated as well. And knowledge is power, but it still is a tension that I think all of us in this room and at this conference can attest to the fact that you still need help, even if you're really educated. I went through this with my daughter. Hemophilia is not considered to be a female dominant disease. And yet, as time has gone on, it's begun to unfold more and more that women can have bleeding disorders and specifically hemophilia and it's probably far more common than what we anticipate. We actually believe on the ground that it's probably a 3-to-1. For every male, there's probably at least 3 women that have it as well. That in the textbooks as it stands right now, still here today, it's still really taught that that's not possible. And so I'm an advocate. I know a little bit about what to ask and what to say, and I help people with this every day, day in and day out, and advocating for my own girls to get the care and treatment that they needed became a hurdle that was very difficult for me personally, and it shouldn't be. And so I just think that part of, moments like this is so important for us to gather together to talk about important issues because there's kind of an infinite learning that we all have to do. So the fact that there's a lower amount of people that have the verbiage and the understanding it's probably the elephant in the room that we all understand and know. But I think the solution is infinite learning and partnership and collaboration.
That's a great point. When I was looking at this statistic and I went deeper into whoever said, well, what's the definition of health literacy, right? Yeah. It's even being able to communicate. So many people go into that doctor's appointment and don't ask the questions of, I'm not sure what you're talking about. What does this mean for me?
Right.
So it's the ability to properly communicate.
Or being able to push back when you're told one thing
That's right.
that you know is not your experience,
That's right.
And that was actually kind of the point I wanted to make about health literacy. It is about understanding those definitions and what the different swim lanes are, if you will, that you can navigate through the healthcare system, but also something I learned not just in the emergency room, mainly because I wasn't probably as open to learning when I was much younger. I knew a lot more then. But what I've learned in healthcare, when you're talking to patients or their loved ones and you're delivering news that's difficult, hard, sad, scary, any of those things, that their capacity to remember is drastically reduced. And so as healthcare workers, I think the most important starting point with communication, especially if you're bringing new patients into a practice or you're issuing maybe a specialty med to someone who's never had that disease diagnosed in the past or that medication, to meet them where they are. And you can't ask where they are necessarily because people don't understand that they're not going to remember what you've told them. So being repetitive is important. And it's understanding not just what those terms are, but that they can ask for another opinion. They can say, that sounds frightening to me, but as healthcare providers, understanding that they may not ask us what we mean by that. So asking people to help you understand what you've retained. Ask them to tell you back, what is it that you think the next steps are? I think that that's enormous for people to be able to make a choice that's informed. They have to have all the proper information, and if they don't have all of that yet, or you don't think their capacity is there to process it and use it in an effective way, then it's a waste of both of your time. We want to all be efficient, so I think just being repetitive and asking for people to repeat back is going to be huge in bridging that gap.
I think it's health literacy is very crucial in empowering individuals to take an active role in their healthcare management and being able to advocate and giving them that confidence. Like me, for example, when I first, had to start going to the doctor with my daughter with her condition, even with what I read, it still was a lot of information and overwhelming, but having a nurse that, explained things and pointed me in the direction of more information, there's a big difference from when my daughter was 1 and now that she's 9 when I advocate. Because of learning and health literacy, I was able to when it came to medications, and there was a medication that came out, and it was for people with sickle cell, but my daughter wasn't old enough. But I was confident enough to ask her hematologist, hey, even though she's not the age, she's the height, she's the weight, and this is something that benefits people with her condition. Is there a way to maybe go back to the insurance provider and, argue that though she's not 5 years old, she's the same age and weight, and this is something that will benefit her? I had the confidence to do that, where most people may be like, well, the doctor said I can't do it, so maybe I can't do it, I'll just have to wait. I would have had to wait like 2 more years, and she was able to get a medication that was for 5-year-olds at 3 because of my literacy in healthcare and having that confidence to even question and ask her hematologist to go further.
And knowing where to find those resources, right? That's part of that health literacy piece, is knowing where to look. 1 in 5 households in the U.S. speak a language other than English, right? So when we talk about health literacy, that creates another barrier. And in some cases, individuals are bringing their family members to interpret for them, who may not already understand the terms that are being said. So it creates a gap. We take this a little further, and I know this is a touchy subject in the nation, but a poll from Kaiser Family Foundation revealed that 1/3 of Americans think that racism in medicine is a problem, right? Which leads to a lack of trust. So I want to shift, because we're talking about literacy for individuals, and I try to be very intentional when I say individuals, because people are humans outside of being patients. They are humans first, right? So individuals, we focused on those individuals, but we haven't talked about healthcare facilities. We haven't talked about healthcare providers. How can healthcare facilities better equip their teams to provide quality care while effectively addressing diverse social factors? We talked about the language differences. What if it's religious? What if it's gender identity? What can they do?
I think definitely cultural competency training, cultural sensitivity, diversifying the staff. Like, I'm a community health worker, and I think that's really important when the patients that I deal with that are impacted by sickle cell, they appreciate seeing somebody who not only looks like them, but has been through their experience. And even if I couldn't relate in that way, I can relate on a cultural level to be able to talk to them. So that's really important. And, facilities and providers across the nation could definitely benefit from cultural competency training and having a more diverse, team of people, care team for the patients that they're caring for.
This is off script, and I can barely see everyone, but a show of hands, your organization has provided cultural competency training in the last 12 months. Look around. Look at the number of hands that are up. And for every hand that's not up, imagine the number of other organizations who are not providing that training, right? And there's always something to learn. This is ongoing.
I'm gonna hop in here because as a nurse, if there's other healthcare workers in here that aren't nurses but are clinicians, you may have something similar to this, but in my state, for my license, we have had added implicit bias training. And our training for that is online. I'm here to tell you it's kind of dry, and it's done. I did it 2 years ago. I was like, oh, did it. Yeah. And then Accessia Health brought in a team, and we did implicit bias. And you can ask my boss if you see her. She'll let you know that I was like, I've already done this.
She did.
And well, I didn't though, right? Because when I took this class that was with my entire company and in person with a trainer, what I learned was that I had even more implicit biases than I realized. And I do admit that I have them, right? I know that I might think people should do things a certain way because that's the way I've done it, or because I've seen it done well. But for me, it opened us up to having some uncomfortable conversations and being able to say, there are people that look a lot different than me, and our country has, everything has been pushed to, you look on TV and movies and commercials and everywhere, and everybody does look like me, but that's not helpful to the folks that are trying to find ways to get through this healthcare system and have all these scary factors like people that don't look like me, or people that don't think like me, or people that don't have an understanding of my disease. We are working on a project right now on the community side in Louisville, Kentucky, working in a zip code that has a drastically lower life expectancy for Black men than its next door neighbor zip code. 11 years, by the way, 11 years less life expectancy than white, than the very next door zip code. And this is where I worked for about 17 years as well. And what we've done is group together with community-based folks in the faith-based community who live and breathe and coexist in the same zip code, and they've bridged that gap with us. We've brought together all of the community healthcare workers in that community to help train them on how to provide outreach and help us bridge that trust gap. And we had an event a few weeks ago, and it was amazing to see the whole community coming together. And I think we did 12 or so health screenings that day for people who had no intentions of getting their health screened that day. So there is a lot more that we could do if we could just be uncomfortable for a few minutes and admit that there are more things we could do every day in our practice to be inclusive of all the other humans that might not feel as comfortable asking for help.
That's good. You know, we've done a little bit of work in reaching out to, well, we do a lot of work in rural health, but we do some work in the Hispanic communities that we serve especially, and it's interesting because some of the trends that we've seen has been that even, you talked about the 1 in 5 homes speak another language other than English. One of the things that we've run into inside the Hispanic population, which is probably the second most common language, right, in the United States, has been that some of the medical terminology is not translated well or even done proficiently to the same level, you know, in Spanish as it is in English. And we've actually done quite a few patient education seminars and things like this, specifically trying to tailor, you know, education in that capacity. And one of the challenges that we've seen is that so many people say that they don't like a translator a person that's actually translating the lie. They would prefer it done in their language natively. And so some of those tensions are really difficult to manage, because how do you we still have quite a few people that speak French as their primary language. So, when you talk about ultra minority populations like that, like how do you tailor programs? And again, it's really cost driven, right? It's like, how do you do that in such a way? So I'm hopeful that technologies will help us with AI and some of the new things that are coming around. However, I would say at the end of the day, I really believe that the human component, the human factor, and our ability to have compassion for one another is our greatest resource. I think that's, I don't mean to oversimplify it, but I really do believe that with a consolidation of power, there's less accountability. And to me, everyone having a seat at the table and having a voice in the input is actually what gives us all a higher level of accountability. And as long as we approach that table with a great deal of compassion, I think progress is inevitable. It's when we begin to get closed-minded and we don't have people that people feel comfortable with when they walk in the door, that really can become its own barrier. And I don't claim to understand at all what someone, in an ultra minority group would feel like walking into a doctor's office, but I'm already at a disadvantage because I walk into my doctor and my blood pressure's through the roof and I have white coat syndrome and I know all this stuff, And then, but you put that at a disadvantage, living with a rare disease that almost no one's educated about, that's a disadvantage. And then on top of that, if you don't even want to make the phone call because you don't think anyone's going to understand you, or no one's going to be able to relate to you, or they approach you, the person that's educated approaches you as if you can't understand, that level of discrimination has no place in healthcare, and we all have to contribute to making that better for all of us.
Yes. Yeah. That's a really great point, and I know there are some, even medical schools, that are trying to teach that before these students are graduating, but many of these doctors that you're seeing are already practicing and may not necessarily be receiving that training. But you brought up a good point. You talked about the power of collaboration, right? Because I think that's going to be key, and we're going to hear that throughout the entire conference. How can organizations collaborate to identify those solutions that are really going to create change? How do we get there?
More seats at the table. That's my answer.
Seat at the table. Yeah.
Listening.
Well, and I think being here, and as was the kind of call to action at the opening this morning, is everybody here has a different touch point, with the individual that is, looking for different solutions along this healthcare journey. And so what do you take away from this? And more so, what kinds of connections do you make? This is off script, but it speaks to the power of connection is, having different contacts inside advocacy organizations. And when you talk about an ultra rare, one of the ultra rare conditions that we support currently, there was a parent of a individual who was called in wanting to utilize their travel assistance for a hotel room across the state line because they couldn't get things navigated to get an infusion, an enzyme replacement infusion that was required every 3 weeks. And this is a child who had just 18 gone across the state line to college. And it was a real mess. And we were already, I think, 2-3 days late on getting a transfusion. And they wanted to get a hotel room, so there was somewhere clean for this nurse to meet him and get this. Now, we would have been able to pay for that room, and I think ultimately we might have helped with that. But at the end of the day, I had met an advocate in that very ultra rare space and sent a message by email, and within 2 hours I had 4 different people in that advocacy organization involved on the phone with the family, got the insurance squared away, and that was the last transfusion that patient had to cross a state line to go get. But that was because I knew somebody who was inside the walls of an advocacy organization that was willing to say, oh, we're here, that's what we do. 911, this is an emergency, and they took care of it. So I wouldn't have had that contact if I hadn't come to a conference and found folks to connect with. So make sure you do that.
So good.
Jen, I'm going to touch on this would love you to touch on this. What role does patient assistance organizations play in eliminating some of these barriers or addressing those barriers?
Well, I think like we talked about before, is not enough to just go seek the donations for specific conditions or support for certain medications or treatment types even, but to do the research, do the homework, that's what we're supposed to be doing, and find those populations of people and understand fully what it is the different gaps are in care in different areas. I'm going to plug this in really quick. You're going to be getting a QR code here, or you can stop by our booth, but we're doing a really brief 2-question survey. And it's really just to be a little more impactful about what we learn when we come to conferences like this. It's just going to ask for what your role is, and it's going to ask you what the biggest barrier is that you see every day, because we all work in such different ways. And I've already learned like 3 different areas that I don't really have any contacts in. So if you get time today, fill that out to help us all help you with that information to improve how we provide care and support our programs.
So we've tossed around the term holistic. We understand that holistic means caring for the whole individual, sometimes the spiritual needs, and we talked about working through faith-based leaders. It means that we're looking at those socioeconomic factors as well. We're looking at transportation. What do you see as the most significant impact on people when a holistic approach is not taken?
Can you say holistic is the answer? I mean, I think that it's so important, and this to me ties into the diversity conversation too, is that we really have to see people as human and not see them as a data point, not see them as I think a lot of times the system is so much, it creates its own set of problems. We all do what we do because the system is riddled with problems. We've heard the term broken system today several times already. But in the context of the system being the problem, I think oftentimes as people who are trying to help, we look at trying to see how can we make improvements systematically. And I would argue that that's probably not the best place to start first. Our first place isn't to try to fix the system. How long have we been in this country trying to fix the system? Mm-hmm. And how many bills, and I'm not against all this stuff, I mean, this is what we do, right? But how many things are we doing that are pointing to the system needs to be fixed, or we need to try to systematically improve these things? And those things sometimes move the needle. But I would just say the simplicity of just seeing people as human and starting with compassion and doing anything you can. When you see somebody on the side of the road and they have a flat tire, not just assuming they have a cell phone on them that they can make a phone call, but actually pulling over. These things used to be just common knowledge. Today I get to call it genius because it's not common anymore. But if you do those things, sometimes you look like a hero, and that's not at all what we're trying to be necessarily, but it's this idea that sometimes the most basic caring conversations is where it starts. And so I would just say, like, sometimes the enemy of holistic can actually be us trying to systematize something that needs to just be a calm, caring, listening ear to somebody in a point of need.
We've lost compassion.
In some ways, yeah.
Yeah.
It's so easy to get clouded by the system being the problem that you want to just try to point to the system as being the solution. But I don't think that that's always the case. I think the work that we all do individually is what contributes to the whole.
Agreed. Georgianne, I have a question for you. How do you as a caregiver persist when you feel unheard about your loved one's care, right? Jonathan's saying that we all together can make a change, but as a caregiver, what are you doing? How do you show up for your child?
I'm really annoying. No, but you just have to just keep speaking up and asking questions, and sometimes just not taking no for an answer, being okay being annoying or being, considered a problem, which is something that sometimes in our culture, it's hard because we know if we ask too many times or our tone isn't the right way, then it could do more harm than good because of those, biases and things. But for my kid, as a caregiver, I'm sure for anybody who's caring for a loved one, even if it's not a kid, I don't care if you don't like me or if you think I'm a problem. You can, talk about me when you leave, mumble under your breath. As long as we get done what needs to be done to benefit my child, I really don't care. You have to not care. Like I used to be like, oh, I'm not gonna ask that, or I'm not gonna say it. They're gonna think I know too much or I know everything, because I've had, healthcare providers like, are you trying to do my job? Are you trying to be a doctor? And it's like, no, I just want the best care I want the same care that you probably want for your child or your loved one. However you would treat them if they were in this situation, I want the same exact thing. And
That's
if
good.
that means me asking you the same thing 10 times, 10 different ways, or going to Google something and say, hey, I just read this, what about this? Then that's just what it means.
Advocating.
Advocating.
That's why we're here. So we're all going to head back to our communities where we work, live, play, do whatever we do in our communities. What is one actionable item that each person can take to make an impact?
Gotta mix it up. Gotta get out of order. Think outside the box.
Well, I think that we already touched on that, is making sure that you take with you at least one contact. If you only leave here with one contact, then you probably need a little help with gathering contacts, and we can help you with that. The app has, I believe, like an area where you can type with folks, but just get out there and ask people, find out what they do, find out what area they work in, and find some good matches for folks that can help you move the needle, even if it's just one patient that you help with this one action. But I think also take some stories with you. That human component is really huge, and it makes a difference in somebody's day if you just say, I hear you. I hear what you're saying.
Yes.
That's awful, and just sit with it. Brené Brown, as you might have heard, we are reading that right now at work, and it talks about just making sure that you allow yourself to be vulnerable, because we can't really hear people being vulnerable if we aren't also in that space. And it doesn't mean that you tell people your life story or that you overshare. It means that you allow yourself to feel a little uncomfortable for a minute and ask whatever question you find you might need to ask in order to make the individual feel more comfortable asking questions. Make sure they understand that there's not going to be some change in their treatment plan based on their answer. Because there's very big fear behind asking to understand even. I've had individuals say, I didn't understand that, but I didn't want to ask because I was afraid that they maybe wouldn't move forward with the treatment. And that's a real fear that I don't fully understand, because I've always known to advocate for myself, but that came from many years of healthcare and not having fears, so.
That's good. I feel like that in this space, we have to be coaches as much as we are, practitioners, in the sense that many of us are living with our own challenges, set of issues. A lot of us here this week are in the roles that we're in because we had a personal experience, and it really inspired us to be that. So I guess to answer the question, to me, the way I interpret that is more about what do you do when you're overwhelmed and you're just, even as a caregiver, like, the whole caregiver exhaustion thing is real, right? Mm-hmm. And so as professionals, we also get a little overwhelmed by all the stories and all the things that we're just constantly trying to help people. I mean, it's my dream job to help people all day, and I get to do that. But I get tired sometimes too.
Yes.
And so how do you handle the exhaustion, to me, is I really try to focus on finding what inspires me, like getting back, and sometimes that changes. Like Tuesday it's tacos, but like Wednesday, like it might be something else, you know? And so, but find something that is, like what is it that inspires you, and get really good at that. But then part of how we become effective is also being able to do that for others. You can't lead others unless you can lead yourself first. And I really believe that if we can get good at inspiring ourselves to keep going when we're tired, when we're exhausted, when we've hit the wall, then we also can do the same for others. And sometimes, if it's true that the straw is the thing that breaks the camel's back, maybe it's the one more thing that also helps us provide breakthrough. You know, I don't think that sometimes it's always about solving the whole haystack. Sometimes it is about just finding one step. And so listening to what people's needs are important. Having compassion, I believe, is vital. Seeing people as human from a holistic point of view is essential. And then how do we coach through that, and how do we navigate that ourselves? It's really about finding that point of inspiration. And I have to say, sometimes that's hanging out with you guys. I mean, seriously, sometimes, you know what I mean?
Yes.
And to your point about having one more number, if you don't know anybody else at this conference, come talk to me. I'll be your +1, and we'll figure it out. But I mean, the deal is that it doesn't have to be rocket science. It's just about linking arms together, putting more seats at the table, and if the table's full, let's get another table and find more seats, because we need everybody's input to make everything better.
Love that. Love that. Perfectly said. Do you have any takeaways that you'd like to share?
Yeah, one thing that we say a lot in the sickle cell community is just listen. So whether you're a healthcare provider or whatever kind of professional you are, even as a caregiver, just listen. Sometimes we like to think we're, or maybe we are the subject matter experts and we think we know what's best, but if you're not that person with an illness, that patient, no matter how much you study, you don't, have the experience of somebody that's living with some kind of, ailment or rare disease or condition. So sometimes you have to just listen, and not listen to respond, but listen to the patient, to the individual, so they can tell you what is going on and what their experience is. Sometimes they actually might know a little more than you as far as their condition and maybe the best way to manage it. Even in my own experience, just being a caregiver, even being a parent, sometimes my daughter will say stuff and I'm not trying to listen, and she's like, no, listen to what I'm saying. I'm telling you that when I do that, I don't like it. It doesn't make me feel good. And just the other day, every morning before school, we give her medicines, and I just routine, give her the drink. One she doesn't like, so she still drinks it through a syringe, so I just get the biggest one that I found, and I'm just like, hurry up and do it. And so she threw up all over her uniform, and I'm like, oh my God, you threw up, now you gotta go find a new uniform. And she's like, well, Mom, you shouldn't give me so much so fast, because it'll make my stomach hurt, and then when I go to school, I can't eat breakfast because my stomach hurts. And I'm like, all I'm thinking is, I gotta get her this, she has to go to school. And she's like, no, you need to give me a smaller amount and let me take it in 4 doses instead of 2 shots, so that I don't get, and I'm just thinking I just need to hurry up and get it down, but we have to listen.
So that's great. Collaboration and listening to understand and not necessarily respond. We are out of time, but I am going to challenge you for everyone to stand up. Everyone stand up in the room. We'll stand with you to make you feel better.
All right.
But we want you to find someone that you do not know, someone that you are not sitting next to, someone that you did not come here with, and we want you to exchange information, find them in Swap Card app, because together, if we are collaborating, we can make a difference, and Jonathan said that so well. There are resources on the screen. You can scan the QR code to answer those questions, but we challenge you to connect with someone. Thank you.
Awesome. Thank you, Tiara, Jennifer, Georgia,